guys, this is Dr. Hub. Today let's look at the cephalosporins. Under the cephalosporins, we are looking at the classification. So cephalosporins, there is a first generation. The first generation, we are looking at the parenteral. So under parenteral, there is the cephazolin. Next we look at the oral. So under oral, what do we have? Under oral, there is a cephalexin as well as a cephadroxil. Next we move on to the second generation. So under the second generation, there is again parenteral. So under parenteral, there is the cefuroxime. There is cefuroxime as well as a cefoxitin, and then there is also the cefotitan. So cefuroxime, cefoxitin and the cefotitan. Then we move on to the oral. So what is present in the oral? In the second generation, it includes the cefaclor, and there is also the cefuroxime acetyl, cefuroxime acetyl as well as the cefprozil. Next we move on to the third generation cephalosporin. So in the third generation cephalosporin, again the parenteral, it includes the cefotaxime. Then comes the ceftriaxone. Then there is the ceftriaxone as well as a ceftazidime. So this is nothing but the anti-pseudomonal. It is the anti-pseudomonal. Then there is also the cefoperazone. So this was the parenteral under the third generation cephalosporin. Now let's look at the oral. So under the third generation oral, there is the cefixime. So fixime and cefpodoxime. Then there is the cefnidir, cefbutin as well as the ceftamet. Next we look at the fourth generation. So under the fourth generation, there is again the parenteral and the oral. Parenteral, it includes a cefepime, and this is the anti-pseudomonal. Then comes the cefpirone. Lastly, we move on to the fifth generation. The fifth generation, it includes the parenteral. Parenteral is nothing but the anti-MRSA activity. So this includes the ceftaroline, as well as the ceftobiprole.